Hello, this is Lisa Campbell for Aspen University talking about medication noncompliance. What is medication noncompliance? Medication noncompliance is when a person fails to adhere to their treatment program. A person may stop taking their medications and miss their scheduled appointments. It may be found through a computer database when reconciling medications. The person has not been refilling their medications at the pharmacy. Overall, the lack of self-care, a decline in their condition, showing no improvements, having further complications, can be brought on by the client being non-compliant in their treatment. What are some reasons for non-compliance? The client may not agree with recommended treatments. The client may feel anxious or fearful about what is to come. They may have to change their lifestyle. The diagnostic test may be too demanding financially or physically. The client may not be motivated to follow through with monitoring or follow-up plans. Some people are intimidated by doctors or other clinicians. Denial is a defense mechanism that can play a big part in a person being non-compliant. A person can feel overwhelmed by the treatment regimen. Chronic illnesses can also lead to depression. The depression can lead to isolating, not wanting to care for themselves, feeling pessimistic, and have low self-esteem. Cognitive decline, such as in cases of dementia, can also play a part in a person having non-compliant behavior. Important to note is cultural differences that a person may identify with. The clinician should be astute in cultural awareness and be able to understand the client's viewpoint regarding an illness and management of illnesses. Drug or alcohol addiction can hinder a person in their healthcare needs. The person may not be able to stop using long enough to tend to those needs. Financial barriers to healthcare may not be the fault of the client, but the high cost of tests can deter one from getting the adequate care that is needed. For instance, MRIs or other scans can cost into the thousands. If the person does not have adequate insurance coverage, they may have to pay out of pocket for these tests, and in most cases would opt out of having them done. So what are the risks involved with non-compliance? Failure to meet treatment goals can be an obvious outcome of a client being non-compliant. A person may end up feeling ashamed, guilty, or like they have failed in some way. They may feel self-conscious or act defensive. Depending on the illness being treated, there can be negative repercussions that go along with being non-compliant. If a person has high blood pressure and they fail to take their blood pressure medication or change their lifestyle or dietary habits, this could eventually lead to a heart attack or stroke. If a person is diabetic and fails to adhere to their blood sugar monitoring, medication, dietary changes, then this could lead to lifelong complications that lead to blindness, circulatory problems, amputations, etc. If a person is depressed or anxious or in recovery from drugs or alcohol, and they fail to adhere to their treatment regime, this could result in job loss, family estrangement, frequent relapses, overdose, and possibly death.